Without objection.
Mr. Speaker, it's hard to believe that the war on drugs has lasted 40 years. The stories of Americans who have suffered because of the war on drugs continue to flood my inbox. Even veterans who served our country are victims of our senseless drug war. For instance, Alex from Franklin, Ohio wrote into me. Alex is a U.S. Army veteran with chronic pain and muscle spasms due to his service to our country. After returning from his deployment, he was put on opiate muscle relaxers from the VA clinic, which didn't work well for him. Following a friend's recommendation, he tried medical marijuana, and it worked for him. However, he was forced to quit in order to accept a new job, and his pain returned. He returned to the VA over and over again, searching for something to relieve the pain. Their only answer was to prescribe stronger and stronger opiates, far stronger narcotics than marijuana. When that didn't work, he was sent to physical therapists who didn't have an answer either. But because he lives in a state that doesn't offer access to medical marijuana, he's forced to have a very difficult decision between living with his pain or violating the law. Another person who wrote in is Bob from Fulton, Georgia, who wrote me to share the story of his wife who suffers from systemic lupus for over 30 years. Lupus has slowly deteriorated her body, destroying her hip joint and shoulders. Multiple doctors have said there's nothing they can do to relieve her pain. During those 3 decades, they've tried all sorts of powerful, approved, and legal narcotics to no avail. The only thing that has relieved her pain without side effect and makes her life better is medical marijuana. Again, unfortunately for Bob and his wife, their state does not have access to medical marijuana, like my home state of Colorado does and 14 other states. Bob ends the story about his wife by saying she's 65 years old and can only look forward to pain and agony. I'm sure there are many folks in our country in the same situation. Releasing them from the threat of arrest and incarceration simply for trying to live a pain-free life would be a godsend for these patients and their caregivers. Is this the reason that we're waging a war on drugs? To ensure that sick people continue to suffer from pain unnecessarily or are driven to buy stronger, more powerful, and more addictive narcotics? Now, there's a lot of views of what a more sensible marijuana policy might look like. My own approach is support for legalization and creating a regulatory system similar to what we have for alcohol and tobacco. We can regulate access, make sure people are not driving under the influence, prevent minors from accessing drugs, tax drugs, and engage in public outreach and education campaigns about the dangers of marijuana. Taxing and regulating marijuana would save taxpayers billions of dollars and generate revenue. In fact, each year, federal government spends $8 billion arresting and locking up nonviolent marijuana users. Again, not marijuana dealers, not marijuana growers. $8 billion spent locking up nonviolent marijuana users, like, for instance, if Alex, the veteran, or Bob's wife in Georgia could very well fall victim to that if they're in the wrong place at the wrong time. Taxing and regulating marijuana would also make our communities safer. Removing marijuana from the criminal market would free up police time so officers can focus on violent crimes, property crimes, people driving under the influence of alcohol, marijuana, or any other substance. Tax dollars could be used to incarcerate real criminals who threaten public safety, rather than veterans like Alex, who are simply using marijuana as a less powerful narcotic alternative to deal with their pain than the opiates that are fully legal under the law and prescribed at the VA. Instead of reaping these benefits, our country continues to suffer under the failed war on drugs. We need to put an end to this war on drugs, which has caused so much needless suffering. The government should treat its citizens like responsible adults instead of interfering in their lives, and should offer to help those suffering addiction instead of incarcerating them. The proper front to win the war against narcotics abuse in this country is a health war, not a war of violence. We are losing this war. Addicts continue to suffer needlessly every day. Those who would benefit from medical marijuana are continued to forced to violate the law or live their lives in pain. We can do better as a nation. Many states are leading the way, and we at the federal level need to pursue the direction that has been followed by an increasing number of states and regulate the use of marijuana in a way that is compassionate, discourages usage among minors, and make sure that we have a health aspect to dealing with addiction where it exists. I yield back the balance of my time.
Chair recognizes the gentleman.
Without objection.
Mr. Speaker, 40 years ago this month, President Nixon launched the war on drugs. 4 decades later, I asked through new media for Americans to share with me their thoughts on what I believe to be a major public policy failure. Just listen to this story of Neil from Baltimore that Law Enforcement Against Prohibition shared for me. Late in the evening on October 30th, 2000, Neil was awoken by the ringing of a telephone. As the commander of training for the Baltimore Police Department, late-night calls weren't unusual, but this call was different. He was told that one of his officers had been shot and taken to the hospital. The officer was a corporal and a 15-year veteran and undercover narcotics agent for the Maryland State Police. He was assigned to a drug enforcement task force and on that night was making his final drug buy in Washington, D.C. from a mid-level drug dealer when the dealer decided he wanted both the drugs and the money for himself. He returned to the car the officer was driving, paused for a moment, and shot the police officer at point-blank range in the side of the head. Arriving at the hospital among the scores of family and friends, Neil was guided into the room where the officer laid with his head bandaged and bloody. Neil had to face the officer's wife and children and explain why their caretaker was no longer with them. Neil finished his story by writing, "When the people are gone and quiet comes, so does the question, why?" Initially thinking of the covert operation, you rehash the event. How could this happen? What went wrong? What was the protocol? But then I realized that the questions I was asking dealt only with the symptoms of a much larger problem, the war on drugs, the broken policy of drug prohibition. A comprehensive objective government study over the last 4 decades has recommended that adults should not be criminalized for using marijuana. And medical science tells us that by any reasonable health standard, marijuana is comparable to alcohol. It's less addictive, less toxic, and unlike alcohol, marijuana does not make users aggressive and violent. And we also know that criminalization comes at a very high cost. Each year, more arrests are made for marijuana possession than for all violent crimes combined. Again, each year, more arrests are made for marijuana possession than for all violent crimes combined. Marijuana arrests in the U.S. average 850,000 a year. That's one every 37 seconds, and 89% of those are just for possession, not manufacture, not sale. Now, marijuana prohibition is even having a negative impact on our national parks and forests. We have Mexican drug cartels growing millions of plants on federal land. We've been down this prohibition path with alcohol, and it failed. It increased crime and violence, crime bosses got rich, murder rates skyrocketed, and the prisons filled, and deaths from tainted booze soared. We're seeing the same results today for marijuana prohibition. Prohibition has not stopped people from using marijuana. In fact, marijuana is the largest cash crop in the country. It just gives criminals and violent gangs an exclusive franchise on marijuana sales. It drains resources from law enforcement that would better be spent fighting violent crime. It makes it harder to keep marijuana away from children. So what have we learned in 4 decades of the failed drug war? It's this: the harm involving marijuana, the biggest part of the harm involving marijuana, is caused by the criminalization of marijuana, and it's time to bring it to an end. Let me end with the story of Brian from DuPage, whose son was caught up in the senseless criminalization of marijuana. When Brian's son was in 8th grade, an incident in school led to the discovery of a small amount of marijuana. Charges were brought, he was sentenced to community service, but the real tragedy followed. As a result of the incident, Brian's son was barred from re-entering any school in the district. He was forced into a school for delinquents where he was grouped with kids who had committed violent crimes. He was basically treated like a criminal. Needless to say, his education suffered immensely. Here's what Brian, the father, had to say about his son's experience. Did doing this teach my son a lesson? It didn't help him. It harmed him. It disrupted his academic achievement. The school district solution to finding a small bag of marijuana was to expel 4 students, no education, no counseling, no help, just kick them out and wash their hands of the whole thing. Now, using marijuana is harmful. Smoking is harmful. Drinking is harmful. In fact, I applaud the FDA's new highlighting of the dangers of smoking and encourage similar efforts to discourage marijuana, which are impossible under the current criminalization regime. The war on drugs hurts America, wastes billions of dollars of taxpayer money, fosters drug-related violence, and does nothing to help Americans who are confronting serious addiction, a serious health issue. After 40 years, it's time Congress put an end to the drug war's 40 years of failure. I yield back the balance of my time.
Chair recognizes the gentleman from California.